नमस्कार, येवकार तुमकां हो पॉडकास्ट कार्यवळीन आनी हो पॉडकास्ट वी ब्रिंग इन एसोसिएशन विथ मणिपाल हॉस्पिटल्स. आमी पळयता की दैनंदीन जिवनान आमचे लंग्स बिकम्स एन इम्पॉर्टंट पार्ट ऑफ अवर लायफ. म्हळ्यार जर दुयेंस जालें लंग्साक जाल्यार आमचें लायफ कितलें पेड्यार जाता आनी कितलें कटकटी जाता हें सगळ्यांक खबर आसा. आनी ताका लागून एडवायस करता की सिगरेट ओडनाका, ताका लागून एडवायस करता की अशें कांयच करूं नाका जाका लागून तुमच्या लंग्सांक त्रास जातलो.
In association with Manipal Hospital Dona Paula.
पूण सद्या जी एअर क्वॉलिटीचो प्रॉब्लेम आसा, डस्टाचे पोल्युशनाचो प्रॉब्लेम आसा, ताका लागून आमकां कितलो त्रास जाता, ताका लागून कितले लंग्स अफेक्ट जाता, हे पासून बाकीच्या लंग्साच्या दुयेंसां विशयी उलोवपा खातीर आमचे बरोबर आसा डॉक्टर जॉन मुचाहारी, इंटरव्हेन्शनल पल्मोनॉलॉजिस्ट फ्रॉम Manipal Hospital. So doctor, what I was saying in Konkani, by now I think you must be knowing a bit of Konkani.
Yes, I've been in Goa since many years, since the past at least 7 years maybe. Yeah, I do
So
get it.
you understand Konkani?
Yes.
Okay, so the issue is that I might not smoke, I might not do anything that might affect my lung, but what about the air quality? Right now everyone is speaking, especially when it comes to Delhi.
Yes.
It still affects your lung.
Yeah, you are right when we speak about that. We have that notion that only smoking, affects our lung function. But the thing is that the pollutants that is there in the surroundings, it do take a toll of your lungs. Especially now in Goa. I came to Goa when it was 2017. Since 2017 till now, I've seen the changes that is happening. Even you have seen the changes. Lot of construction work going on. No doubt it's for the development, but with that comes the dust pollution, with all the things which affects the lung. So even in our practice, we have seen that in this past few years, the people with respiratory issues surrounding these areas, adjoining areas where construction work is going on, it's quite a lot. So yeah, the air quality do affect our lung function. And apart from that, one thing is there that when we grow old, we never grow stronger. So every year after the age of 30-35 years, our lung function declines to around 65 ml to 100 ml per year.
Okay.
Yeah. So that is a natural physiological process which you cannot stop it. Okay. Apart from that, with all the air pollution, and if you take smoking, it will take a toll of your lung health.
Okay, there is one Instagram reel which was going on wherein they say ki how long you can hold your breath, and then they were asking to hold your breath, and after certain seconds they say yes, good, better, wow, you have good lungs. Is it like how much time you are able to hold your breath, how breathe, is it what it determines how strong my lungs are?
It may not be very specific, but yes, it will tell you like the elasticity of your lung, how good you can hold it. For example, we have to understand first the structure of a lung. The lung is like an elastic balloon, right? So if you have a fresh balloon in your hand, and when you blow it, the air comes out immediately.
Okay.
Now when you keep on blowing that, like for example the balloon is very old, the elasticity has gone. So when you blow the air in the balloon, some air still remains inside, right? So in that condition, you won't be able to hold your breath.
Okay.
So a condition like chronic obstructive pulmonary disease, okay, there are various diseases. So now when you're talking about that particular test, a normal individual may be able to do it, but a patient suffering from, there are two types of diseases normally we classify. One is restrictive lung disease and one is obstructive lung disease. So in that, if you see, the patient won't be able to do that. And actually that is not a test like in which I can tell that you have a good lung health.
Good lung health or bad lung?
Yes.
How long but I should be able to hold my breath?
Anything more than 15 to 20 seconds should be fine.
15 to 20
Yes.
seconds. Less than that means have a little problem? Or?
There is, to be frank enough, there is not a specific thing.
Okay.
So in order to know like how good are your lungs are, we do something known as pulmonary function test.
Okay.
So that will tell us.
So doctors won't ask you to hold your breath?
No, No.
How long you are able to
No, that is all in the reels and all that thing. But for us, if you want to know the lung function, whether it is restrictive, obstructive, how bad are your lungs functionally, simple pulmonary function test.
So respiratory problems are heart-related diseases or they are lung-related diseases?
It's only lung related. Respiratory means the lung.
Hmm.
So it basically involves the lung. Sometimes it may be a combination of both, but when we tell only specific respiratory, it just pertains to the lung.
Okay, a common question that is asked when I get a cough.
Yes.
Okay, because of cold I get a cough. So many times people say ki take this medicine, take this syrup, and I don't go to doctor. Why are you going to doctor? Take this syrup and you'll be fine. Is it advisable or you need to go to doctor and show him?
Okay. So I'll tell you a different again perspective of this. So when you get cold, normally it's because of the viral infection. That's it, first thing. So the natural course of this viral infection is that by the end of 3rd or 4th week, it'll go away on its own if you don't have any added secondary bacterial infection, whether you take medications or not. Okay. So in between, when the cough becomes too much, when there is change in the color of the mucus or something like that, it indicates that it may be secondary bacterial infection. That's where the doctor comes in and adds the antibiotic. But as a whole, if you are not immunocompromised, if immunity is working well, this will pass on. You just need to take symptomatic relief. So that's what happens. If I am the first doctor that a person is visiting to me, whatever medication I give him, he won't get that much relief. So he'll go to the second doctor. The second doctor also will write something. And still then that has to complete, right? That cycle of that viral infection has to complete. Not fine. By the time he goes to the third doctor will just write something and he's the best doctor. because
you get the
by
result.
the time he reaches to the third doctor, the virus is also gone and he becomes the best. So
you get the result.
So I'm always happy to be the second or the third doctor when a person comes to sees me when he's having a viral infection.
So when someone should consult a physician when there is a cough, and when someone should actually come to someone specialist like you for a pulmonologist, to a pulmonologist?
Yeah, coming to the respiratory symptom, like for example, to the various diseases that we have. Now, for example, tuberculosis. If you're having cough for more than 2 weeks, if you're having low-grade fever, mostly in the evening for 2 weeks, you're having loss of weight, loss of appetite. Now, loss of weight, how you'll come to know? You won't be checking your weight, right?
Correct.
It's just that your body clothes will become loose, your pants will become loose.
Physical
appearance, weakness. So yeah, you have to consult the pulmonologist. And if you're having breathing difficulty, if you're having wheezing, you have to consult.
Snoring is a disease?
Snoring. Disease in the sense, snoring is usually associated with something known as obstructive sleep apnea in our field.
Okay.
It's something known as OSA, obstructive sleep apnea. So what happens is that, why do we snore? And why do we wheeze? These are the two things. For example, it's just physics. There is a pipe and you blow an air. If the caliber of that pipe is normal, there won't be any sound coming.
Okay.
But when there is narrowing of that pipe, there is resistance. So the amount of air going inside will cause that whistling sound.
Okay.
So snoring is the sound that is created by our upper respiratory tract. So when we sleep, oxygen, the air has to go in through our oropharyngeal cavity, which we call. But if a person is very fat, obese, and there's lot of fat pad, or there is some anatomical abnormalities inside, so when he's sleeping, lying down, the air won't be able to go inside. So it's a natural body's mechanism to fight back. So it'll vibrate for the air to let it go.
So snoring is a bad sign of health?
Yes, it is not normal.
It's not
so
normal.
Yeah, if a person is snoring too much and there are some other associated symptoms like daytime sleepiness, like he has slept for 8 to 10 hours, but again in the morning he's getting up and telling you that my sleep is not complete, I don't need to sleep. And you see some people, they're just sitting and they're dozing off.
Okay.
Yeah, so these are some of the things that if you're undergoing those kind of symptoms, please consult.
So if someone is snoring, he can come to pulmonologist or someone else he has to go to?
At first, we would like to evaluate
Hmm.
whether he's having the sleep apnea. So at first, we do some questionnaires.
Hmm.
There's some scoring system like something like a stop bank score and all that. Then if he fulfills the criteria that he is moderately or highly risk to have that OSA, then we ask them to do a sleep study, in which the sleep study will confirm, telling that whether the patient is having obstructive sleep apnea or not. And it is very important, it's a very important to diagnose this issue, because what happens is that it affects the whole system of the body,
Okay.
including the heart.
Hmm.
Because when you're snoring at night, when you're having that obstructive sleep apnea, the oxygen is not going
Hmm.
as required, so your heart works more.
Hmm.
So like when a person goes to the gym, he lifts weight, he works hard, it becomes muscular,
Correct.
hard and tough. So your heart becomes tough,
Okay.
it becomes more muscular. So
Hmm.
when you're more muscular, you cannot move, right?
Hmm.
So the heart beating also is compromised.
Okay.
So it's all correlated. So if anyone is having any issues of like too much of snoring, they stop their breaths.
Hmm.
The partner or someone notices that they stop their breath after snoring for some time, and again snores back, daytime sleepiness, and all this, very irritability during the day. And even though he has slept so much, if still feels sleepy, then yes, you should consult.
So snoring, whoever is snoring, consult doctor. Don't ignore snoring.
Yes, if you're snoring like loudly and creating
Yeah.
all the ruckus,
Don't
in the
change
house.
bedroom.
Yes. Yes.
Consult doctor.
Yeah.
Changing bedroom and sleeping in hall the won't.
Yeah, it'll harm you more.
I'll harm you more.
Yeah.
Okay. How do you know whether someone is having asthma? Because many a times people usually cough,
Yes.
and now these days, if you go to see, many a times like more often people are witnessing this cough and cold.
Yes.
So how do you know that thing has come to a level of asthma?
Okay, so when we see this kind of cases,
Hmm.
so asthma has various symptoms. So the most common symptom is like they'll have breathlessness, they'll have chest tightness, and they'll have this wheezing.
Hmm.
And the most important factor, the most important question that we have to ask is whether it's more during the morning time, evening time, and when it's cold, because it has to do something with the temperature also. Basically, asthma is, I don't tell that it's a disease. It's just the body's hyper responsiveness, the lungs hyper responsiveness to any stimulus. For example, an asthma patient is sitting, I'm an asthma patient and you're a normal patient. Now I'm allergic to dust or I'm allergic to cold. So your body is able to take that. But my body is not able to take that.
Okay.
It considers as an enemy, like, okay. So my body will react to it. So the airways of my lung will narrow down, constrict, and cause an inflammatory changes, which will cause that wheezing, breathlessness, and chest tightness. So that is asthma.
Okay.
Now asthma, again, we have that particular notion that it's there since childhood. Not necessary. It can start midlife. There are various types of phenotypes of asthma we tell. Something known as allergic, where they'll have sneezing, running nose, and all that thing. There's something known as non-allergic asthma. There's something known as late onset asthma. There's something known as obesity related asthma. So there is various factor. And the way of confirming that, we usually confirm it by doing a pulmonary function test again.
Okay.
Yes. So that will tell us.
So if they come to Manipal, you can do that.
Yes, we have all the facilities to run the test.
Okay. Another thing what we discuss usually is about smoking. People say that smoking a cigarette might affect your lung. No, many people, though vape is banned in India, you always find it in the market.
Yes.
Okay. Is vaping preferred to smoking, or even vaping is bad?
Vaping is bad. So basically, why did vaping come up? Vaping came up just to help the people who were smoking, to help them quit smoking. So it was as a substitute, thinking that, okay, it will help. A cigarette has around some 7,000 chemicals, okay, which goes inside. So
7,000.
yes, chemicals, in which 250 are very harmful,
Acha.
and then all are harmful.
Huh.
All are harmful. In which, as per the books, 250 are very harmful, and out of that, 70 are proven to be carcinogenic.
Okay.
70 of them.
And
So-
vaping?
And vaping. So now vaping is that they also have those components, but in a lesser quantity.
Okay.
But that doesn't mean that
you can
it's
vape.
safer. Yes, it has high content of nicotine. Basically, why a person get addicted to smoking? It's because of a nicotine component where they get dependent to. And the other thing, the tar, the benzene oxide, whatever, so many chemicals are there. So there are other factors. But the thing is that it's the nicotine which you get addicted to. So vaping also has nicotine, so in which it was used to replace. But again, vaping causes many other issues. There's something known as E-Valley. That is e-cigarette vaping associated lung injury, which is very deadly.
Okay.
Yeah. So when I was doing my fellowship in Malaysia, so in Malaysia, vaping is allowed. You
Okay.
see every one of them vaping.
Huh.
You see them smoking also, and you see them vaping also. It's left and right.
Huh.
Yeah. So we used to get a lot of cases of this E-Valley, and it is very deadly.
E-Valley.
Yeah, it's called as short form as E-Valley. E-cigarette vaping associated lung injury. E-Valley.
So it affects your lung.
Yes.
It's fatal.
It can be fatal if not timely treated.
Okay. So vaping is also bad.
It's worst.
Okay, when we speak about exercises, now Ramdev Baba came up with an exercise wherein he specially showed how to improve your lung capacity. Early in the morning you get up and you do so many exercises, especially breathing exercises. Does it help?
Frankly speaking, I have not seen what he has promoted or what exercises.
Like
But yeah,
you take from here, you leave from here. There's pranayam, and then
I won't
you
tell.
should watch Astha channel.
Okay, sure.
Like
Sure.
Goa News, if you're watching, you should also watch Astha channel.
Okay, I'll keep that in mind, and I'll surely see those videos what they are doing.
Okay.
Okay, any form of exercise is good. I won't tell it's not good, it's not working. Every form of exercise, that pranayam, that that you do, everything is
So
fine.
pranayam is good.
Yes, everything is good. It's for the wellness of the body, of the mind, of the soul. So it's good. I won't tell it's bad. But for us, like for exercise of the lungs and all that thing, it is something known as cardiopulmonary exercises.
Okay.
For example, now if you are an athlete and I'm a normal sedentary person, obviously your cardiopulmonary reserve will be high because you're working out, you're running. So your oxygen capturing capacity is more as compared to me. Your muscles knows to use more oxygen than me.
Okay.
A marathon runner who runs 42 kilometers in 2 hours 10 minutes.
Yeah. Absolutely.
His body knows to use the oxygen more as compared to a normal person. So yeah, obviously if you run, if you do physical activities, and if you're active, they'll help you.
Then there are no lung specific exercises saying that if I do this, my lungs would be healthier.
The only thing I would tell is that be active, and the other thing is that we have specific exercises for various diseases, like for COPD, chronic obstructive pulmonary disease. We give them physiotherapy of breathing exercises, something known as pursed lip breathing, something known as diaphragmatic breathing, in which it do help them.
Okay.
Yeah, for specific illness, we do prescribe them some physiotherapy.
But during our regular routine, for example, if I want to save my lungs, if I get up in the morning, I'm not an athlete, I'm a normal person. So, do you recommend any exercises?
Just go for a walk. If you can jog.
Okay.
Okay. And the most important thing is protection. Protect your lungs. Like no smoking. Second thing is wear mask if you're going to any polluted area. Specifically, like for example, I can tell you, like, do dumbbells for your biceps.
Acha.
for your lungs, like I cannot specifically tell you to do
Okay,
this
for what
exercise.
to do for lungs, I know. For like,
Yeah.
okay, you mean to say
Yes.
you can recommend for physical, this thing,
Yes, yes.
but lungs there is no exercise.
Yeah, not specific like that.
Can we, if my lungs are damaged,
Yes.
can we repair them to the original, reset them to the original?
Now it depends like what type of damage it is. There is something known as fibrosis of the lung. So fibrosis means it's permanent usually.
Okay.
Okay, there's something known as interstitial lung disease. It's a progressive fibrosis of the lung. So the medication we give is antifibrotic. Whatever fibrosis has undergone, it's gone. So we give the medication in order to deaccelerate or prevent the remaining lung from getting fibrous. So if fibrosis is there is nothing much that you can do about it. Okay. Regarding the damage of the lung, like it depends on by what disease it's damaged, how it is damaged. For example, in chronic obstructive pulmonary disease, in interstitial lung disease, now it's been so advanced that there is lung transplantation.
Okay.
Yes, and that's the new thing of pulmonology, which is
You can transplant the lung.
yes,
So when we donate our body, you can
Yes.
also donate the lung.
yes.
And once someone is dead, for how many hours the lung is active?
So basically, like what they do is that they have a team. Okay, there's a transplant team. So which consists of the pulmonologist, which consists of the surgeons. It's a team. So basically, once they come to know that someone is about to expire, or so the transport is being done immediately within a certain frame of time.
Okay, that is a green corridor. which
Yes,
is
exactly. So these are mostly done in big metro cities at present, like Hyderabad, Chennai.
created. Goa also
There
has it.
he-
We have done it. Not
Yes.
for lungs. I don't know.
It's for the
it
other
was heart, I
heart.
think,
Yes,
or
yes.
kidneys
Just
also,
recently,
liver, yes.
few months back.
So no. My question was that someone is dead. So how long his lung will be usable?
Now, I'm not sure with the specific timing because we are not into that transplant thing. But it has to be done as soon as possible.
ASAP.
Yeah, there's a time frame period which I'm not that well versed with, but within the time frame, it should be done.
Okay, tell me about your experience in Manipal. What kind of patients you usually get in Manipal?
In Manipal, we get all the type of patients, like which starting from normal common cold to interstitial lung disease, chronic obstructive pulmonary disease, lung cancer, and bronchial asthma. Like we do get a wide variety of patients coming.
So lung cancer is a cause of concern. Lung cancer can happen only with your mistake, or it can also be hereditary that you can get a cancer.
Sometimes when I meet patients who are diagnosed to be lung tumors at the age of 34, 35, there was a time 6 months ago where in 1 week, 2 young female patients at the age of 35, both of them were diagnosed to have 4th stage lung cancer. They have never smoked in their life.
Okay.
So how do you answer to that?
So
Now,
what
for
does-
example, if a person is telling that, I've been smoking and he's detected to be lung cancer, I can at least blame it. You have been smoking. Oh, that's why you got lung cancer. Now, there are so many factors. We just cannot tell that, okay, smoking only. Yeah, smoking do cause, but it's not necessary that all smokers also develop lung cancer.
So what do research say? Why did they get a cancer when they didn't smoke?
Now, it can be because of sometimes genetic factors. Okay, it can be sometimes because of the pollutants. So those are the main things but we cannot blindly point out to a specific factor telling that इसके लिए आपको lung cancer हुआ है.
What are the number of cases in Goa? Are they frequent as far as lung cancer is concerned?
Yeah, since 2 years that I'm here in Manipal, I do get a lot of lung cancer patients because for me, I mostly do the diagnostic part. So a patient comes to me with something on the X-ray, something on a CT scan, or with fluid in the lungs. I do the diagnostic part with the help of a bronchoscope or with the help of a thoracoscope. I just take the tissue, prove that it's a tumor, and then it's handed over to the oncology team, which medical oncology or the radiation oncology for the further treatment.
Okay.
So
But you are the one who identifies that it is a lung
mostly
cancer.
my role in lung tumor will be first the diagnostic part. Then
Okay.
it will be handed over to the specific oncology team.
So you don't break the news to the patient.
I do break the news. to
How
the patient.
difficult it is?
At first, I have to like really explain them. I never break the news first to the patient, because if a patient loses his hope, then it's very
Loses the battle.
Yeah. So after speaking to a relative, then we break the news. There are some patients who are very strong. They accept it,
Okay.
and like you also feel yourself like how strong they are. And there are some patient like who cannot take it. So there are two different spectrums of that, and there are still some people who are still fighting. So yeah, it's sad, but the thing is that the early we diagnose, the better it is.
So how do we keep our lung healthy? Eating habit. One you told us is to walk, jog.
Yes, I myself is into running. Okay, I run regularly. So the thing is that when you are running, your body, your muscles require more oxygen. So you breathe in,
breathe out.
more.
Yeah.
So your cardiorespiratory system is healthy, and you're burning a lot of calories. You're fit. So when your body is able to maintain that, so that's what I tell, like, just do some activities, walk, jog, run.
Physical activity.
Yeah, physical activity. Don't stay sedentary.
Okay. Sedentary lifestyle is dangerous.
It's dangerous.
Okay. So one is walking. Otherwise, don't smoke. That is, don't vape.
No smoking. Then don't keep yourself away from pollution, because even a non-smoker patients, for example, like when we do something known as bronchoscopy, where we go inside the lungs to take some samples, or when we do thoracoscopy, like we put the scope inside to see the coverings and all. Even in non-smoker patients, you'll find the black tar lung. Patient has never spoken. That is because of the pollution.
Outside pollution.
Yes.
Delhi must be worst, I think. No?
You
are not practicing in Delhi, but you must be having colleagues in.
That's what exactly I wanted to tell you now. Like there are some patients, most of the patients, half of the patients, they come from North India. So when we do this diagnostic procedure, I'm surprised to see the lungs. It's almost black as a smoker who has smoked heavily. But when we ask them, आपने cigarette पिया है? Sir जी, cigarette life में touch ही नहीं किया. Then you realize, okay, it's because of the air pollution.
आप दिल्ली से हो. And it's sad it is. No? Someone for no fault of his,
exactly,
he is losing his lungs, and you
Exactly.
cannot. These are something which are irreplaceable.
Yes, that is true.
Okay, so now coming back to the same thing, COVID was one part. Okay, we have noticed during COVID the knowledge about lung, people started speaking कि उसका इतना % लंग डैमेज हुआ है, इतना %, 90% डैमेज, अभी वो बचेगा नहीं, अच्छा only 40% डैमेज वो बचेगा. The people started getting that medical knowledge about lungs. So those people who suffered COVID or had COVID, are they facing problems now, or their lungs have recovered?
Okay, this question. So I think so we almost all forgot what COVID was like. It's been
5
how many
years
years?
it is.
5 years.
Yeah.
Our memories are quite short. How much ever the severity is, we tend to forget.
I know.
Okay, so
Bad memories has to go also.
that's true. That's the positive part of it. We have lived it. So
Yeah.
how bad it was, we know. Especially in Goa when the positivity rate was 50%.
Absolutely.
We were the worst to suffer.
Yeah.
So these questions even patient do ask, but it has been decreasing over the last 1 to 2 years.
Okay.
Before that, patient coughs, he'll come, doctor, COVID झाले माका. 3 वर्ष पहले lung damage झाले, खरस मारता. So everything was, blamed towards COVID.
Okay.
Yeah, no doubt there are some people who have suffered, during COVID, what happened was that they underwent fibrosis of the lung. So if the fibrosis was extensive, then obviously the patient will not recover fully.
Okay.
Now the patient whose damage was not that much, they have recovered.
Huh.
And people are doing fine. So people who have been following up with us regularly, so they have improved.
Okay.
But the people whose damage was very extensive, the symptoms, the issues with them remains.
They're still there.
Yes.
We have seen after COVID again, now the frequency of getting cough has increased. Earlier it was only once a year. Now many a times I call up many of my friends, they half of the time they are coughing only. So it has become a new normal for someone like to cough. Is it is it only my impression or it is true?
It is our impression also, because see, as a pulmonologist, the person with cough only will come to me first. Okay, so there were seasons like in March, early March, patients will be more. From December, January, the patient will be more. Then suddenly there will be less patient. Then suddenly when the rainy season starts, the patient will be more. So we used to have this kind of season.
Correct.
But right now, it's almost the same.
And
the incidence, the incidence has become more. And the thing that we were talking about previously about the AQI, about the air pollutants,
immunity also. Sedentary lifestyle also.
Sedentary lifestyle. And second thing is that the incidence of diabetes, the incidence of all this obesity, everything has increased. You ask every second, third person, he's having diabetes, he's having these issues, so many issues. So when the immunity also decreases, the virus is ever ready to attack you.
Absolutely. TB was something which the central government took very seriously, and they started working on TB eradication. Now, Goa, as far as Goa is concerned, I think our figures are quite encouraging that we hardly have any TB patients. Is it true or is it just a government figure?
So the government has been very proactive. Okay, they've come out with everything in order to eradicate and eliminate tuberculosis. But first we have to know tuberculosis, 1/4 of the world population is infected with tuberculosis. So we have to know the difference between infection and disease.
Okay.
Now even you may be harboring a TB bacilli. I may be harboring a TB bacilli. Now, for example, you're going in a crowded market. There is one TB patient. He just coughed out next to you. You have taken it nicely inside.
Okay.
You don't know about it because you cannot see the bacilli. Not the bacilli won't put that his mycobacterium tuberculosis and fly around. It'll just go inside you. Yeah. So your immunity is good. So your body will fight and seal it.
Okay.
And that bacilli will remain dormant. Like it is of no use.
Okay.
So maybe after 10 years, you got diabetes. And your immunity is less. You have not controlled diabetes. So that bacilli, which was that tuberculosis, which was hidden, will come up and it will become a disease.
Activates. Okay.
Yeah. So when we tell that we'll eliminate, see, India is a very diverse population. Now if we tell Goa, okay, basically maximum is Konkani. Okay. So it is very easy, like to have a particular rule, particular implementation for that particular thing. But when we say India, it's diverse. You see, I'm from Northeast. In Northeast only, in my district only, we speak some 6-7 languages.
Correct.
One community is totally different from the other. Now you come to North India, South India. So when it comes to implementation in different parts, it becomes a bit difficult.
Tough task.
Yeah, tough.
But are you getting TB patients?
Yes,
right
yes. Definitely. We are getting
TB patients.
Yes.
But they are cured.
Yes, it is 100% curable. So we have all the diagnostic facilities for tuberculosis. The patient comes to us, we do imaging, and then we prove it with getting the bacteria, sending it to the lab. So there's something known as drug resistant TB. So that can be found out within 2 hours.
Okay.
There's a machine which is called as CBNAT, cartridge based nucleic acid amplification test. You give the sample, within 2 hours the results are out.
And then treatment starts
Yes,
immediately.
immediately.
And then you get well.
Yes, 6 months of treatment and you're fine.
But seriously, you have to take all the tablets.
Yes.
Don't joke around.
Yeah, you have to take.
One more thing, do we need to wear mask now? Because the kind of information that you are giving, I think I should also start wearing mask now when I go in. Regularly, you should wear mask.
Frankly speaking, I wear mask only when I'm in the procedure room. Yeah, but I would, advise you, like if you're going to a very crowded place, if you're going to a place where construction is going on, especially now you see from Panjim to Porvorim to Mapsa, till that area, it's all filled with construction. So yeah, when you're going through that and all, it's always
Better
advisable to wear a mask.
Especially when you're on a bike and you're crossing.
Yes, helmet and a mask.
I know.
Yeah.
Save lungs, save
Yes, the
head, brain also. So, mask could be a general usual mask. Even cloth mask would do.
Yes, perfectly. Cloth mask will do. The normal surgical mask. You don't need to wear an N95.
Yeah,
for
that was introduced during COVID.
Yes.
Still remember.
So the thing is that if you want more protection, see, N95 gives 95% protection.
Okay.
Now the surgical mask that we normally wear, that gives
that-
around some 40-45 protection.
That blue color one.
Yeah, the blue one, exactly. So now if you wear a cloth mask along with a surgical mask, it gives around 80% protection.
Okay.
So that is like your N95 almost.
So wear a mask.
Yes, just
advisable.
wear a mask.
That is better.
Yes, that is better. Like not every time.
Okay.
Only when you are in that polluted.
when you doubt that there
Yes,
is the pollution around.
Yes, that will
When
obviously.
for many diseases you have a preventive things, like if I have a heart functioning, I can have a stress test
Yes.
done. Is there any test for lungs to check how healthy my lungs are? Can I just walk in Manipal and just come to you and say, ask doctor, check my lungs, how good or bad they are?
Yeah. So if you come to me, so that's how I'm gonna take it. First I'll ask you some questions. Like obviously whether you're smoking, whether you had any repeated lung infections in the past, whether you had any history of breathlessness, wheezing. Then the other thing is that by looking at your age, if you're above 40, 50, I would just like one plain x-ray to be done, chest x-ray. And the other thing is to see the function of your lung, we can do something known as pulmonary function test. Now, there is one catch point. Now, if you are more than 50 years of age and you have been smoking, there's something known as pack years that we calculate.
Okay.
So if pack years is more than 10, it is significant for us, for the patient to develop COPD or lung cancer. But if the pack years is more than 20, then it becomes very high risk. So if you're 50 years of age, if your pack years is more than 20, then I will tell you, please get one low dose CT scan done of your chest. That is screening for lung cancer.
Okay.
Yeah.
So I'll get to know the symptoms.
Yes.
In advance.
The thing is, the symptoms, lung cancer won't come with a symptom.
Okay.
By the time you have symptom, in most of the patients, it's already at the 4th stage.
Acha, you don't even get it on first, second, third stage.
Hardly. See, for example, the patient may just cough like, he'll think gas ho gaya, sardi ho gaya, over. Then after 3-4 months, it becomes more, he becomes breathless. Then he decides, I'll go to a doctor. By the time he goes to a doctor, you see that already the fluid has formed.
Okay.
This has become.
Then again, the treatment is like a normal cancer treatment.
Yes.
Oncology.
We do the diagnosis, and now there are different types of lung cancer. Also, treatment also have improved. So it's not like how it was before. Now we have immunotherapy, the tablet kind of chemotherapy.
Okay.
Yeah. So there are different types of lung cancer. So if you fit into those type of lung cancers, which will respond to those after the testing of that biopsy sample, then you can just pop in those tablets.
Okay, so it's not painful.
No, it's oral medication.
Thankfully.
Yes.
Okay, last about Manipal, second last I want you to do something else. Second last, what are the facilities that are available in Manipal? And I'm comparing it nationally.
Okay.
Nationally, if you look at Manipal's facility in your own department, how best they are?
So in Manipal, over the past 2 years, we have developed it. So basically, regarding the patient care and all, right now currently we are two of us, myself and Dr. Ashwini. So we are managing the department. So when it comes to the diagnostic facility, for us, the diagnosis is the foremost thing. A patient walks to us, walks to me, I have to know what the patient is suffering from. So the diagnostic part is the most challenging and the most important thing to be done. Patient has come to me, I've just given some medication and go. It doesn't work like that.
Okay.
I have to know, the patient has to know why he has come, what problem is he, and then the patient leaves the hospital.
Okay.
So this is what I have been following since the last 2 years. And if a patient is also admitted, the patient has to know why he is admitted. Most of the time what happens, patient will come, ye zale, ye dile, go home. Next time he comes back like to other doctor, kya hua tha? Admit hua tha. He doesn't know what he is suffering from.
Exactly.
So for me, the patient, whatever is being diagnosed, whether it's a pneumonia, whether it's COPD, whether it is asthma, he has to know what the disease is and what are the cure, what has to be done to improve that. Okay, so this is how we take care of the patient. And second thing is that regarding the diagnostic part, we have got new instruments for the diagnosis part. For example, which is known as interventional pulmonology.
Okay.
So ours is the only center like from Kolhapur to down south you go, it's Manipal.
Okay.
So in this belt, coastal belt, so we have got a facility of something known as endobronchial ultrasound. So how we do ultrasound of the chest from outside.
Okay.
We have an bronchoscope with the ultrasound probe inside.
Okay.
So for example, just to tell you in very simple terms, this is a tunnel. Okay. So you want to take a biopsy.
Okay.
But that sample is not in the tunnel. So even if you put the scope in the tunnel, you won't be able to take the biopsy because it's outside.
Correct.
It's over here. So how we are going to take it? So we do something known as endobronchial ultrasound. With that ultrasound probe in the scope, we put it over there and we go through the wall and take the biopsy. So this facility is available with us.
In Manipal.
Yes. So this is very important for diagnosing something known as mediastinal lymphadenopathy. Something known as mediastinal lymphadenopathy in the sense like it is somewhere outside the tunnel.
Okay.
See, airway is like a tunnel. Right. So
it is
anything outside the airway.
Okay.
So how will you take the biopsy of those nodes or of those tumors or mass, whatever? We do something known as endobronchial ultrasound. So that facility is available only with us right now, and we are doing it. And there are other facilities like if you have fluid in your lungs, normally what we do, we take the fluid and send it for diagnosis. But we don't do that. Like we prefer doing something known as pleural biopsy.
Okay.
The covering. So we just put a scope and take the biopsy because most of the time the fluid will not give you the correct diagnosis.
Okay.
But when I take the sample of that pleura biopsy, that is 100% diagnosis. If it comes, it'll come. If it doesn't come, means there's nothing to worry.
Okay.
Yeah, so that's what I'm telling. Like when you come to us, we'll make sure that we'll diagnose it.
You will know what is.
Yes, what it is.
Okay. Last, I want from you, few of my friends who are chain smokers.
Yes.
You say something so that they are afraid of smoking, so that I can cut this video and send it to them, so that at least they will reduce number of cigarettes, and better if they quit smoking also. Say something which is.
Okay. I have a lot of patients who smoke, so just I'll give you the same advice that I'm advising them. There are two ways that you can stop smoking. It's all in the head. Okay. First thing, it's all in the head. If you want, you can. No doubt you may have some issues, those tremors, that sweating, because you have been smoking.
Smoking.
Okay, so and there is something known as turkey method. It's like you decided from now on you're not going to smoke, you just stop it, you don't look back.
What do you call it as?
Turkey method, like you just cut it off.
Okay, turkey method.
Over. Yeah. Okay. And the other thing is something known as you're smoking, for example, 20 cigarettes per day. That's, I think so, around every half an hour he's smoking. Because 6-8 hours he'll be sleeping, right?
Yeah.
So every hour he's
People
smoking.
smoke one cigarette and then they smoke another with that.
So in that case, you can decrease. For example, you are smoking 20. Okay, you 15, 10. Okay.
Reduce.
Reduce the number and then stop it. But usually what happens is that they just go back again to it. So what I tell him that you just stop it, and there is something known as nicotine gums. Okay, then nicotine patch, nicotine gums, chewing gums and all, and lozenges, which they can chew. But not like you go to the pharmacy counter and then mere ko nicotine do, mujhe khana hai. Not like that. You just take professional help, because we'll be there, we'll be calculating how much the requirement is, and then prescribe you. Like it has to be taken. There's a particular way in which it has to be taken. There's a timetable for it, based on the number of years you smoke, how many times you're smoking.
Not like a chocolate.
No. This is what most people are doing, and they come and tell, "Arey doctor sahab, nicotine to kha rahe, kuch nahi ho raha hai." It doesn't work like that. And the other thing, and the most important advice is that, and it works. For example, if two of them are smoking, one is smoking because the other one is smoking. It is always like that. If they don't meet, they won't smoke.
Correct. Yes.
If they meet, they will smoke.
Peer group. Like.
Exactly. Don't meet for some time.
phone.
Because if you meet every day, you smoke every day. You meet in the morning, afternoon, night, 3 cigarettes you smoke. So decrease the number of times a meeting per day, or don't meet for a week.
Phone pe baat karo.
Phone pe baat karo. Jo bhi hai. So this is one thing. Like this is the most common thing that happens.
Okay, that is like, let's meet over a smoke.
Yes. दोस्तों के साथ जाओ, दुकान देख लिया, गया.
चाय पिया, smoke किया.
Yes.
So that increases.
Or avoid that person who
is not good for you.
Not good in the sense like to save yourself.
It's not good for your lungs.
Yes.
Thank you very much, doctor. Thank you very much. And again, jenka smoking quit karpache asa. Kindly watch this last part, and especially this is dedicated to all my friends who have been chain smokers, who feels that they can't quit smoking. So this is one last part. Kindly save this part, and I'm sending you videos. Few of them whom I know, I'll send them personally this video. Save this and watch this time and again, so that you quit smoking, save your lungs, live longer. And again, this podcast is sponsored by Manipal Hospital. So their slogan is life is on.
Yes.
So let life be on. You're watching Hub podcast on your favorite channel, Goa News Hub. Keep watching us.